things obviously need to be done, and one possibility are health passports, that as you go into your football ground, for example, they can just check it on an app. They can just hold something up against your phone, and if you get the tick up on the phone, then you are safe to go in because you've recently been tested. And the people behind that, in fact, have been working with Mike and Zara Tyndall, who are ambassadors for their company, and I saw a little film of them having the test, which is very similar to the test that I had, that said I had the antibodies. Joining us now, it is Lewis James Davis, the CEO of VST Enterprises, the company behind this. Hi, Lewis.
Hi, how are you?
Yeah,
Thanks
we're
for welcoming me onto the show.
It's good, yeah. We're very keen to hear what you can do, because I think we all want to get back into stadiums. So, as I said, this is a simple little pinprick blood test, isn't it? As I said, I was part of the kind of Imperial College thing. I was sent one at random and had this test, and was surprisingly, because I'd not had any symptoms effectively, found to have the antibodies. And this is what you're testing for, isn't it?
Yeah, so essentially the VHealth Passport is test agnostic. So this is just one of the tests that we do support. It's a rapid test that does test for antibodies, and it shows the antibodies as early as 3 days. But we can do any form of tests, which opens this type of platform up to everything from air travel, sports, normal live events.
What are the practicalities of this? I mean, how quickly could we see this enacted? And is it as easy as Paul says, just sort of a passport that allows you into the stadium?
So every test that we're working with currently allows you to get a test to passport in 10 minutes. So essentially you could walk up to a health clinic that you booked through the VHealth Passport system and walk away with your passport, allowing you to gain entry to events. Our system's been working in the past with the likes of the United Nations. We've been up and running for 6 years, and that's why we got the technology away so quickly for COVID.
How regularly would you need to test, Lewis, on this? Because obviously there's an expense involved. I mean, how much will the kits cost to test for this? And obviously, is it something that would be done every couple of months, or how frequently?
So our platform allows the healthcare practitioner to set how often that person needs to be tested. And this eventually will see how long your antibodies last. So the tests fluctuate in price based on the volume. So we are marketing it to the sports industry for £15 volume.
Right. So £15. You say you market it to the sports industry. Is there an expectation that they would front the cost of that for their customers, or would it be on us?
So there's various ways we can do it at the moment. So we are looking at ways to co-sponsor it. So
his line's a bit...
We are struggling a bit with the line, I'm afraid, Lewis.
So this test, let me just clear where we're trying to get him back. It shows you that you've had it. So therefore, if you've had it, you can't then...
From what Lewis said, there are various tests.
Because a test to see whether you've actually got it or not doesn't really help you, does it? Because if you say you can be at the health centre and it says you haven't got COVID, and then by the time you've got to the ground, you could be infected on the way in, couldn't you? I mean, surely only the thing that says you've had it would mean that you were clear. Only people who've had it surely would be clear to go and watch sport. No?
Well, that's not the test that, as I saw Zara Tyndall and Mike taking a little bit earlier on TV. That was telling them they hadn't got the virus at that time. I think we have got Lewis back. So Annie was just asking the question, Lewis, that is, if you've got the antibodies, that's only showing you've had it. But obviously, so is that saying if you've not had it, you can't get into your football stadium?
No, so the rapid test itself, what we advertised on TV with Mike and Zara, that tests if the person currently has it or had it. So it's testing for 3 antibodies.
Right.
Yeah, because had it and has it is a different thing, isn't it? I mean, had it means you're clear, you're not going to infect anybody.
Yeah.
Has it means obviously you are infectious.
But the test is working on both levels. So and then that's the important thing, isn't it? So and then is there a sort of, you've got to be honest about, if you want to go and see a football match, you upload and you say, I've definitely haven't got the virus at the moment, so you say I'm fine. I mean, are you going to be trusting people on that or not?
So we're linking the VHealth Passport via API to ticketing agents. So the ticketing agent would know that you've had a valid test before you attend the event.
Right.
Oh, okay.
So that limits the amount of people that will be going to the event in the first place. And when you get scanned at the event, we've got people like Halo, one of our partners, who has the VCode scanner embedded into their system, and they can check the passports are valid on entry.
Right. We lost you on that frequency of testing point and how regularly you would need to do this. So, in an ideal world, how often would you to keep your passport up to date, Lewis? How often would you need to do this?
Yeah, so it depends on the different types of tests that you have. So we can set that in the platform, and it's down to the government guidance. But at the moment, we're saying you need to be tested every 2 weeks. Okay,
and do the tests need to be readily available? Obviously, are they available at the moment in sort of chemists or wherever? How readily can you get the test, or can you only do it sort of via registering with the company?
So this is one of the main reasons we stay test agnostic. It's because no one manufacturer can provide the world with the tests that they need. So we can provide these type of tests via pharmacies in the UK. We've got currently 200 listed on our website, which you can book a test from, and we're soon to be 1,250 in the next week.
Right. So, I mean, there have been around about 15, they talked about a price point of about £15. And if you're doing that every couple of weeks, that could get quite expensive, couldn't it? So, say a subsidy from the clubs or hopefully more tests coming out and that making them a lot cheaper would be fairly key to this. Otherwise, you might want to go and see your football team play, but if it's going to cost you, 30 quid a month, that might be pushing it a bit.
Yeah, so the more these tests come out into the market, I'm sure the test price will come down.
Yeah.
But at the moment, it is a kind of supply and demand. And that's one other thing where the passport comes in handy, is it validates the test that you're using, that it is authentic, it has come from the right place, and it's a full supply chain management system down to the passport.
So are you confident that with this sort of thing that we can get back to stadiums, we can get back to comedy clubs and theatres and things like that? Would this allow us to do that if this rolls out well?
Yeah, so I'm fully confident in the passport technology. The test accompanying that would be great. We're also launching a venue code, which means that every venue could apply for a VCode and start mapping out contact tracing. So basically, you could check into somewhere as a symptom check, and that would be assigned to your health passport. So if you went to a venue and somebody got tested there, it would put a notification in the system to come and get if somebody tested positive that day.
Okay, look, appreciate you joining us.
Best of luck with it,
because it'll be good for all of us if we can get this off the ground. So thanks for joining us, Lewis.